We are going to have a wonderful presentation from our information systems folks at the Children's Bureau, so I don't want anybody to miss it. And we have with us today Mark Jazo. Mark, let them know who you are. He has 6 years as a senior analyst in the Children's Bureau Division of State Systems, and he's previously worked in the vendor community and the construction of large human services information systems. And he also worked for 20 years as a counselor in the Colorado State Juvenile Justice System. And he's still here to tell the story. Mr. Jazo has a degree in economics, sociology, and a master's in information systems. And we also have with us the mysterious Terry Watt, and I'm going to let him start off by telling you a little bit about himself.
Not much to say. I am what I am. We're going to do we're going to try something a little different. Hopefully it'll work. Hopefully we don't fall totally on our face. Mark Jazo and I are going to do a little skit for you.
Okay, here we go. This is Terry, and I'm going to be representing the state of Nirvana. And we're a little confused over here about information systems because we've been hearing a lot of misconceptions and misperceptions about SACWIS. Now, how many people know what SACWIS is? Can I see a raising of the hands? Okay, about half the group, I would say. You know what this is. Okay, if we have time, what we'd like to do is probably walk out and see if you have a few questions as well. Because what I'm going to do is I get a rare chance of needling my boss here for a little bit with some questions, and he's going to answer up. So if there's additional questions, if we have some time, we'd like to go out and ask the audience as well.
We're really trying to deal with a lot of the myths out there, and there are tremendous amounts of misunderstanding about what SACWIS is and what SACWIS isn't. You'd be really surprised on what you can do with the SACWIS systems and what you can build to support your case practice models.
Well, hold it, Terry. I'm supposed to be asking the questions.
So
anyway, you're going to answer up here. Okay.
We've set the framework.
So again, we're going to call this SACWIS myth busting, right? Is that what this is about?
That's what it's about.
That's what it's about. So I'm calling up Mr. Watt. I wish I had a telephone here. Guess I could use a cell phone. And my first question is, we're thinking about building a SACWIS in our state. But I've been thinking about this a lot. I hear a lot of rumors out there on the street. I talk to my colleagues. They're giving me a lot of information. I don't know what's right. And so, Mr. Watt, could you talk to me a little bit about SACWIS? First off, what is SACWIS and what are some of the advantages of building a SACWIS system?
Well, great. Let me start by saying the first thing that I want to compliment you on, Mr. Director, is the fact that you're calling us. You're calling your federal partners at the beginning and saying, let's talk, let's go through some of the issues here. The first thing I want to make sure you understand that SACWIS is an option. You don't have to build a SACWIS. There are lots of parts of the SACWIS that you can build differently than your neighbor's system. What SACWIS does is it gives you a consistent application to view your case practice model through as your children and your families move through your process. Kids don't stay in one spot. They don't stay in one office. They don't stay with one county. They don't stay with one provider. They move. You need a consistent view of what's happened in that family and what's worked and what hasn't worked. And a large information system such as SACWIS will help you do that. SACWIS will give you historical information that you can look back, see what worked, what didn't work. You'll be able to pull your federal reporting out of it. Another advantage, and I don't really like to emphasize this, is you do get a little bit of extra money if you build one system. Again, I said it was an option, so if you exercise your option to build a non-SACWIS, we'll still give you FFP. It just won't be at quite the same rate.
So that's a good point, because one of the things I always hear is that SACWIS is a mandated system, and you're saying it isn't.
Absolutely not.
And that's a decision I, as a state, make, and we talk to you after we do our homework. Is that right?
The state and its users should make that decision.
So I'm hearing all the pros. What are some of the disadvantages or cons?
Well, anytime you build a single one-size-fits-all system, you're going to have compromises. So, I mean, that's a clear disadvantage. if a single large system doesn't meet your business practice model, if you have counties that use their own, that follow their own practice models, if you use a lot of private providers that want to use their own system, a SACWIS may not meet your needs. Certainly, a large system is less agile than a smaller system can be. It takes a little bit longer to change, and sometimes it costs more money to change. And finally, you're going to have to conform with the SACWIS model. And there are a lot of requirements under the current model that you may not feel are appropriate or needed in your state. So
Well, I want to get back to a couple of these things in terms of what the SACWIS model is. But the one thing I do hear from you, and I want to explore this a little further, is that you're saying me as a director of my state, I should be reaching out to the community. I should be finding out what our practice is, what our need is. Is that correct?
that is absolutely correct. Why build an information system that doesn't meet your business needs? Bottom line is you have to support your practice model. The idea is not to build a federal reporting system. The idea is not to chase after the SACWIS funding. The idea is build a tool that's going to support the way you work with children and families, to collect the information that you need to monitor those families, the progress you're making, the successes you're having. And if you don't reach out to your community, you're going to build a system that people are not going to want to use.
And that's a good point that you bring up, because that means I've got to do some homework before I should actually think about whether it's a SACWIS or just a child welfare information system, of knowing what my information need is, both in policy and practice out there in the community.
Absolutely.
Okay.
Well said.
So I guess the other piece that I want to start exploring is the other half, in terms of these SACWIS requirements. I hear a lot of things out there, a lot of scuttlebutt on the street saying SACWIS requirements are rigid. They don't allow systems to build what they need. It's only about the federal reporting need. Could you talk to me a little bit about that?
Great question. We're not sure where that comes from. If you look at the SACWIS requirements, and they've been out there for a number of years, they're written at a very high level. You have to have an intake module. There's a lot of rigidity to that one. You have to have case management module. Ooh, another rigid one. States define the focus and the scope of those requirements. We had legislative staffers say, you built these things so flexible you could drive a truck through. And it's probably true.
So you haven't changed these requirements.
We've not changed the requirements.
Did you build these requirements?
Actually not. We pulled in 10 states and asked them to help us define the ideal model child welfare system. And at the conclusion, the timing was perfect. At the conclusion of that effort, the SACWIS rules came out. We couldn't have timed it any better.
So are all these requirements then, if I decide to go out with, what was it, 90 components? Is that what you're talking about, 90 requirements approximately?
There are 90 components. About half of them are expected requirements that any system, any SACWIS system should have and support, and the other are optionals based on the state's business practice model and need.
And so that's what I'm matching against. When I go out and I look at what my current practice is in the community, then come back and look at my requirements, I look at your requirements, see if we line up. Is that where current?
You see if you line up, and then you take those very high-level requirements and you tell us, this is how we're going to implement this component in SACWIS. You give us the business case of why you're doing it in that direction, how you're going to do it, and we'll go ahead and approve it and monitor it at the end, at the conclusion.
So my understanding is then SACWIS is supposed to be encompassing child welfare 4B, 4E. But how about if I wanted to go out and I wanted to build child care, JJ, I wanted to go out and build adult protective services into it. Am I allowed to do something like that?
Absolutely.
What's the bottom line on that one?
Well, if you're building in the child welfare arena, and we identify those as programs such as juvenile justice, we'll pay for the common costs up front as a 4E SACWIS cost. If you want to build other human service programs, we'll share the cost with those programs across the functional areas. We've got a number of states today that are building enterprise systems. They don't want to build stovepipes anymore.
Well, that's a good point. I want to follow up there, because a lot of this is already pre-existing. It's already been built in our state. We have TANF systems, we've got Medicaid systems, we've got educational systems. So are we supposed to rebuild this, or can we link up and create interfaces with these systems to exchange information?
If you don't want to start new, start fresh, and build a common system across your enterprise, including all human services, you certainly can link up with other health and human services programs in the state, with school systems, with court systems. We encourage you. We're dealing with kids, and we need to share this information so we can provide the best services and measure how successful we are in providing those services. So yes, you can build enterprise systems, or you can link to existing systems. There are a number of ways to link. You build the old-fashioned interface, which requires a lot of back-end programming, or you can take advantage of newer tools, such as the National Information Exchange model, which will allow states to take legacy systems and build protocols for exchanging information between systems without a lot of rework on the existing applications that they want to continue to use.
So I think my colleagues here would agree that we all want to have a holistic picture of a child and their family, which could come from a myriad of data sources that are not inside of SACWIS. And so it sounds like NEAM, using a data exchange standard, would allow the flow of data coming in, so I could look at all this information via the SACWIS, as well as I could trade information to my partners out there.
Absolutely. We need to break down what I refer to as artificial confidentiality rules. Confidentiality has a place, but also serving these children has a greater place. Think about how social workers work together now in exchanging information. They pick up the phone, they exchange emails, they talk to each other about very sensitive information. We need to look for ways to automate information that, and I emphasize, can be shared between social workers so that they can do their job appropriately. So look for ways to break down those barriers to exchange information across your systems, whether it be mental health, school systems, courts, whatever.
So this is where I get a needle in. Okay, so I hear that, but I'm also hearing issues from the feds saying we can't trade information. My colleagues are saying feds are preventing us from trading information with maybe child support or receiving information from them. Is there any truth to that, or what's going on there?
Unfortunately, there was a wrinkle in our child support rules that caused us a little concern, but we've resolved that with the recent data sharing provisions in the child support regulations that allow us to share information across our information systems. We can use child support systems and parent locator systems to find resources to protect our kids and to move our kids into other alternative care situations rather than into a foster care arena. I encourage you to reach out to your other human service programs to see where you can build those bridges.
So the constraint is minimal.
The constraint is minimal.
We're really encouraging a holistic picture through free data flow with external systems.
Absolutely.
That's the message I'm hearing from you.
Absolutely.
Now I want to change to a little more controversial topic, dealing with some of my private providers. Because in my state, I got a lot of private providers. They may have their own systems. We want to exchange data with us. So are they allowed to be part of the solution as well if we build a SACWIS?
They are allowed to be part of the system. We encourage states to build to their needs. A lot of the controversy is you have a situation where, remember, SACWIS is an option, and we allow states to build a single application to support their case management process. We've had some states want to build what I refer to as the Uber system, but then simply collect data from other systems. That doesn't really make a lot of sense in my mind. If you're going to use it as a data warehouse, build a data warehouse. Build the central state activities that you want to support. Build exchange protocols between the other case management systems and your data warehouse, and manage and monitor your kids that way. A lot less expensive, a lot less painful.
So I'm hearing that if they're doing 4E, 4B work, they should be, in lieu of state workers, they should be using the SACWIS to that extent.
If state is building a SACWIS, the state should build it to support the private provider's needs. Private providers should be at the table when the system is designed. The system should support their reporting needs. The system should report their business practice model.
Let me ask then, a little incentive to bring them to the table. Will we cover any of their infrastructure, hardware costs?
Absolutely.
Or how about training costs?
They're treated as state employees from an information system perspective. We'll put the hardware in their place. We'll put the infrastructure in their place to run the system. We'll train them on the system. We'll produce the reports for them. We'll provide the information that they're looking for. We'll even give them the information that they put into the SACWIS back to them so that they can populate their own information systems without duplicate data entry.
So then they should be part of the solution. If I start drawing out my requirements, they need to be at the table.
They should be at the table. In
Now,
fact, we've told states that they
these
have
costs,
to be.
These costs having to do with infrastructure, software, training, is that a one-time cost or is that an ongoing cost?
That's an ongoing cost.
So we're going to support them as for the life of the SACWIS, which is infinity, is what I'm hearing.
From our perspective, they are state employees.
So what if they do have one of their systems? Can we send data to them?
We will send data back to them from the SACWIS, assuming that they've used the SACWIS to support case management activities that they're responsible for. We will encourage the state, and in some case require the state, to give that information that they agree should go back to the private providers, back to them.
So if they've been part of the solution set, they've been sitting down, doing the requirements, they're sitting in the application design, they were part of the testing, they're training up. I guess what you're saying implicitly is that they have to enter their data into the SACWIS directly. Is that correct?
If their state's going to maintain a SACWIS, that is correct.
But we could, if we wanted to, and we came to an agreement with providers, share data in terms of data load going out to their external system.
Yes.
And there would be no compliance issue with that?
You may send that information back to the private provider system to avoid the need for re-entering it into their system.
So the compliance issue would be if they enter the data, child welfare data, into their system, back into the SACWIS.
And then re-entered it back in.
I gotcha. Well, I'm going to switch gears because you've answered a lot of questions regarding the program involvement. I want to ask a little bit about technology now. I get a lot of vendors knocking at my door. They're all touting SACWIS compliant goods, transfer systems. I'm kind of lost in terms of all of the stuff that's being brought to my door. How much flexibility do I have in choosing a technology?
You have all the flexibility that I can imagine. You can take a transfer system, you can build a ground-up system, you can even purchase a commercially available off-the-shelf software to support your program practice. In fact, we've recently issued a program instruction which allows states and tribes to use COTS, or commercially available software, designed for our program. There's some I believe arcane federal rules that say you can't pay FFP for software designed for our program. Yes, it's there. But we've written with the new APD regs, which is the document that states and tribes submit requesting funding to us, we have a waiver provision which allows us to waive that rule so that we are encouraging states and tribes to even consider COTS products designed for our program area.
Well, one of the things that's going on in my states is that I've got a number of agencies that are starting to build what I'm going to call an enterprise system. Can I be part of that solution and still come in for SACWIS?
Yes, we've got a number of states now taking advantage of the Affordable Care Act funding, 90% funding available for system development to support Medicaid eligibility and the insurance exchanges. As long as you're building modules that support those programs that we can use, you can charge the entire cost to Medicaid at 90% or the 100% OSIO grants that are being given to states for the insurance exchanges. But yes, you should look at getting rid of the stovepipes. I mean, these kids cross boundaries. The kid today that's in TANF may be in the child welfare program tomorrow. You know, imagine being able to look at the child while they're in TANF, while they're receiving food stamps, while they may be in a school system, and identify factors that you've discovered lead them to be involved in the child welfare community at a later date. Get involved with them today before the state has to take action. Frankly, put us out of business.
My job. Okay. One of the things I'm curious about, though, if I want to go out there and look at innovative ideas, try something new that hasn't been done before, kind of venture into an area that hasn't been ventured before, maybe with a technology approach that hasn't been broached before. Is there any flexibility of you guys allowing us to do that? Would you fund us for that? Could we?
Well, about a year ago, we issued another program instruction in anticipation of our efforts to reevaluate the SACWIS rules that proposes a pilot concept where states and tribes can actually propose to do something and test something that is outside of the traditional SACWIS rules as a pilot. We envision this as a stopgap measure because, as many people know, we issued a request for comments on the SACWIS rules about a year ago, and we are looking at them. So if a state wants to try something that may not fit in the current SACWIS design, they can do that through this pilot PI.
So I'm going to kind of go into, I'm going to make a leap here because this is an area that I hear about, and I'm not sure how this fits into the discussion you're having or the discussion we're having. And that is, if we do a pilot PI and we decide to go with it, and we decide to go with a SACWIS because of what we find out with the pilot PI and other things, does everybody need to be using the application? And the concept I'm coming up with, a word I hear is statewide-ness. What is that?
Okay. Let me take that in two ways. I'll start with the statewide-ness. When SACWIS was originally designed, it was intended to be a single application to save money so that you had the consistent look of case practice over your case population. And we weren't building multiple systems, both at development and operational costs. So the idea was to save money and provide a consistent application. Getting back to my discussion earlier about the pilot, you may conduct a pilot, either a programmatic pilot or a information system pilot, outside of the rubrics of the traditional SACWIS and not violate the SACWIS rules. You'll come in with us, explaining how long the pilot will occur. You'll explain when the pilot will be done. And if nothing changes at the end of the pilot, the presumption is that you will integrate that functionality into your state system. But at the same time, I mentioned we are looking at the SACWIS rules.
Well, keep covering for me there, Terry, while I find this webpage.
Are you looking for our state system webpage on the Children's Bureau's website? Good resource. We have a very, very good guy named Mark Jazo that keeps that up to date. You should call him.
One of the questions I have is that I don't know who to talk to about this. It's good that you're sharing your time with us. I can't share your time every day. You got an office you got to run. Is there somebody that can answer these questions? Because there's going to be a lot more once I started getting into this conversation with my folks.
Well, a lot of web pages will give you names, but not a way to contact them. If you hover your cursor over those names under your states, and down below there's actually a list of tribes too that are seeking 4E grants, you'll be able to send an email to those individuals assigned to your state and reach out to talk to them. So yes, you can contact them and start a dialogue.
And can they contact me if I give you my contact information?
They will. If you give me your contact information, well, I'll certainly pass it on. Just watch out for that Mark Jazo guy.
Yeah, I hear he's a wily character.
He's a wily character.
You got to watch out for that guy. Is there technical assistance that's available from these individuals, from our regional offices, that I could be looking up and asking help from?
We have numerous technical resources, both in my office and across the Children's Bureau as well. We have resource centers, we have implementation centers, we have good contacts with our fiscal staff, our program staff, with our staff in the other human service program areas. I have technical assistance contractors, as well as my own staff. In fact, my staff are required, as part of their performance plan, to reach out and talk to all active projects, at least on a monthly basis. I've got some guys that talk to them on a daily basis and even an hourly basis in the case of yourself.
Do we have any of those resources in this audience here?
Any resource centers?
A resource center, raise your hands. We have one back there. We got, oh, yes, there's Linda. Okay. So we see a few here, actually. And you guys have all been acquainted with SACWIS, right? In one way or another. Been around a long time. You know, one of the things is I hear, maybe I shouldn't say it. Maybe it was the way I said that. You have a great deal of experience here you can share. You know, one thing I hear all the time is that feds are non-responsive. They take a god-awful time to get something out of the door in terms of responses to us. Sometimes we send in questions, sometimes we send in requests, and we don't get anything back.
I am proud to say that my staff, on average, take less than 15 calendar days to respond to state submissions. Now, that doesn't mean that if you're requesting response from my office and CMS, that you're going to get your response in 15 days. But my response is done, on average, within 15 days, calendar days.
That's nice. That's very nice.
I credit it to my staff working hand in hand with their state contacts, so the documents that we receive, we know about, and we've dealt with a lot of the issues before they hit our desk.
Very good. So, do we keep trading staff off with these analysts? Is there a consistency there?
I know states hate it when I trade analysts, but you know, work happens, and as workloads shift, I have to move them around. So, yes, that does happen. I try to mitigate it by doing dual staffing as we transition from one analyst to another, but yes, it does
Do you
happen.
review their work, Mr. Watt, before
No,
anything goes out to a state?
Absolutely.
So you are the
You're
body
off
of
script,
consistency for Division of State Systems. Very good.
But I believe Valeria wants to talk to these folks too.
Is it about that time, Valeria?
It's getting there.
Okay, we got just a couple more.
Okay.
And I want to get into the most thorny issue of all that everybody's wrestling with these days, cost allocation.
Oh, tough issue.
What is it? How does it apply to me? As a single SACWIS, if I build one single 4E system versus a multi-optive where I have a number of federal systems that are going to encompass the solution.
Basically, you got to eat this one. You're going to have to cost allocate if you've got multiple systems. If you're building a SACWIS and you're not covering other program areas, it's pretty straightforward and there's very little cost allocation issue. If you're crossing programs, you have to allocate to the benefiting programs. And the rule of thumb is present something that's reasonable. We have tools out there that allow states to build a cost allocation model fairly easily. It's called the CAM toolkit. It's being revised as we speak. I think you're actually reviewing the current draft, aren't you?
Sometime.
But if there are multiple programs that benefit from a component, you have to prepare a reasonable cost sharing of that component. It doesn't have to be as difficult as some people make out, and my staff is available to work with you to try and simplify it.
And I'm gonna bite the bullet because I've been hearing this about some kind of a letter called a tri-agency letter and a shared cost, Medicaid, 90-10 money. Could you explain what that is about?
Talked a little bit earlier about ACA, the Affordable Care Act, and the OMB waiver that grants states the ability to claim allocate cost on a benefiting program concept, i.e. if it benefits Medicaid for eligibility, you can charge the cost to Medicaid. So I encourage states to reach out to their Medicaid folks now You don't have to build the system now. You have to be at the table so that when the system is being built for Medicaid, it can be adapted or used by you 2-3 years from now as you go forward.
Well, Mr. Watt, this has been a most illuminating conversation. I'm on overload at this point. I'm going to go to data. And so thank you very much.
One last thing. If you hear something that doesn't sound right, don't fester on it. Give us a call and say, Terry, Mark, Rick, any of my analysts, why can't I do that? And in a lot of the cases, you will find that we can work something out. There are some things that we probably won't be able to help you on, but there's an awful lot of things where I get pushed back, and I say, but you can do it now. What are you fighting this for? Anyway, thank you all for your time. Hopefully our efforts to try something different work, but I'll let you be the judge of that. Thanks a lot. Valeria?